and then tell us how we're going to go from there on. So thanks very much, and over to you.
Thank you so much, Harry and Suja, and thank you so much for the invitation to be here. It really is our pleasure to be able to present to you today. And, you know, we have lots of thoughts and reflections. This is quite a big project, and it's been going for a couple of years now. So lots of learnings and lots of thoughts on how we could have done some things differently and where we might want to go from here. So it's a wonderful opportunity for us to be able to engage with colleagues such as yourself and hear your feedback and help us to do some of that thinking and some of that reflection as well. So yes, introductions are important. So I should introduce myself. I'm Rebecca Grace. I'm an associate professor at Western Sydney University in Sydney, and I'm the director of a research centre which is called TEACH, which stands for Transforming Early Education and Child Health. So I'm really fortunate today to be joined by some of the other members of the ReSPECT team. My colleague Dr. Kelly Baird is here, and Jonathan and Sammy and Mikhail, who is a PhD student. She has a recording. She wasn't able to be here in person. And Angelica, who is one of our beautiful master's students. So, and there are others in the team as well, of course, including Harry, who's an important member of this team. And as Harry has said, has been instrumental in the development and the thinking around this project from its inception. So we have a much larger team, but this is just a sort of subset of the team, and they're all going to speak today. So maybe as we come to each of their sections in the presentation, they could provide a little bit more of an introduction to themselves. That might be one of the best ways to go, if that's okay. So what I'm doing really is just setting the scene and letting you know how this project started and what it's all about. ReSPECT is an acronym, so you can see on that slide that it stands for Reconceptualising Services from the Perspectives of Experienced Children and Teens. And I always feel like once you've got a good acronym for a project, you know it's going to be great, right? So, so we were excited when we were able to come up with that acronym. As you can see from all of the logos, I see that the slide has moved on. I wasn't quite ready for that to happen. So if Jonathan just pop it back. But you can see from all of the logos that were on the previous slide that this is a cross-university project. And we also have 3 NGO organisations that are partnering with us. So Uniting, Carers New South Wales, and Wananga, which is an Aboriginal organisation. So they're all NGO organisations in Australia. A couple of years ago, I started having lots of conversations with Uniting in particular. Is everybody else having a weird slide experience? How about not? Jonathan, are you controlling the slides? How about I give you a nod when it's time?
No, it was just glitching out on me. Sorry about that.
Oh, okay.
Fix it
all
as
right,
we
that's
go.
fine.
Yeah.
No problem. So a couple of years ago, I started having a lot of conversations with Uniting in particular. They were really wanting to do participatory work and to engage young people in service design and service decision making. They were also doing a lot of thinking around the nature of services and how we could break down some of those sort of more siloed ways of working for young people, and wanting to bring young people and children into those kinds of discussions around development, design, governance, implementation. So we probably met over a period of about 18 months to toss these ideas around and think about how we might support them to do this well, to engage with young people well, and in a way that was sort of genuinely collaborative and a co-design process. Uniting was really concerned about tokenism and not wanting to do that. So we played with lots of different ideas, and as part of that foundational work as well, we decided to just talk to as many people as we could, all the people that we admired and respected about this project, and what their ideas were on how to do this well, and to kind of push a little bit further than we had before in terms of engaging young people in service design. Harry was one of the people that we identified that we really wanted to speak to, and that was part of why we came up with that initial money to get Harry to come to Australia. We just were like, if we can find a way to get you here, will you come and talk to us and help us to think about how to do this well? And that's what happened. We also, obviously did quite a lot of review and engagement with the literature. And we did some very early piloting work just in a high school where we spoke to children and young people about whether or not they were interested in being part of those kinds of conversations, and how they thought we could engage with young people well in service design and decision making. So lots of foundational work. We can move that slide on if it'll cooperate for you. That would be good, thank you. So I'm going to talk a little bit about the design of our project and how we set that up. We're going to talk about some of the barriers that not only that we've experienced as researchers, but also barriers that we've heard from young people and service providers in terms of barriers to effective engagement in service design and implementation. We're going to talk with you about some of the what we're calling solutions, so some of our approaches to addressing those barriers, but also most importantly, some of the solutions that the young people presented to us or developed in terms of addressing some of those barriers. And we'll make sure there's time at the end so that you can ask any questions that you have. Just there, those pictures, that artwork on the left-hand side of the screen, it's some of the artwork that the young people who were participants in our project produced. So just, yeah, letting you know that. We were quite inspired. There's a wonderful woman in Australia called Dorothy Scott. She's now an emeritus professor. And we were quite inspired in our development of this project by some of her work and some of her words. So Dorothy said that a sophisticated social policy response to the fragmentation and inefficient nature of services will only come about by a whole of society response that needs to draw upon the capacity of children themselves to be and be seen to be contributors to the community rather than merely clients and consumers. I really love it because, you know, in Dorothy's speech, she's pointing out that the participation of young people is much more than just their right. And we know that, of course, it is their right to participate. But it's also potentially the way that we can move forward and to find new ways of moving forward. It's about honouring their stakeholder voices and engaging them in innovation, and that this is a way forward in terms of innovation. So I really like that approach and felt quite inspired by Dorothy early in our project. When Harry came to Australia, thanks, Jonathan. When Harry came to Australia, he was still developing up some of his thinking around a participation matrix, and he shared this thinking with us. He has since published this work, and I imagine that a number of you are familiar with it. But when we were first meeting with Harry, yeah, oh, whoops, we've jumped to, there we go, there it is. Sorry, the writing is so small. That is Harry's matrix right there, and I've put the citation on the side there. So I hope that you can see it. But essentially, what Harry's done, and only Harry, he's so talented at really breaking things down and making things very sort of concrete and make sense. And that's what he's done here in such a beautiful way. Harry's listed the different stages of a research project, and then sort of has a continuum in terms of the extent of participation or decision-making control that children have in each of those steps along that pathway. And it was really thought-provoking for us to see this matrix and think about our research. And our goal was to have as much of our research sitting on the sort of right hand, or you know, at least heading in the direction of the right hand of that matrix as possible. One thing that I know when Harry talks about this, he's quite keen to point out is that this is not a tool that is intended to be used for judgment. You know, there are sometimes reasons why it's not possible to have, you know, the right column ticked on every occasion, or lots of pragmatic reasons and lots of things that happen in research. So it's not there to make us feel guilty, but it is there to help us to be able to identify and understand exactly where we sit on that continuum. And our goal for this project was absolutely to try and sit at the participatory end of the continuum. So while Harry set this up in terms of how we think about research and design of research and the analysis of other people's research, I think it's also a really helpful matrix when we're thinking about service design or engagement of young people in service decision making. So the extent to which they're involved, of course, the level, the sort of phases are a little bit different, but not too different in terms of that whole design phase. And I think that's been a really helpful guide for us. So I wanted to just draw your attention to it as a very useful tool. You know, obviously one of the first things we did was look at the Australian literature. So we conducted a scoping review, and we looked at any Australian research that had been published in the last 20 years in peer-reviewed journals that was looking directly at the participation of young people in services. And we did that review across 8 different service systems. So we looked at health, mental health, community services, housing, juvenile justice, education, child protection, and disability. And we were able to identify 205 publications in Australia that were claiming to be participatory and that sought the views and perspectives of children for issues related to service provision in those different systems. So I hope I can explain this table well. So essentially on this side, on that left-hand side, they're Harry's phases. So we were using Shy's participation matrix to look at this literature. So they're all of the different phases in a research project. And then we looked at how many studies involved the participation of children in each of those phases. So if it's the blue line means that children were consulted as part of that phase. The grey line means that children were involved in directing and deciding for themselves what should happen in that phase. The orange means that children were collaborating with adult researchers on that phase. So you can see on the first line, for example, when we're talking about deciding on the research question, there was just one paper of the 205 where children were consulted in the design of the research question and the decision on that research question. And there was one paper in which children directed and decided for themselves what the research question should be. So it's quite illuminating, I think, you know, just how infrequent it is that children and young people are involved in a participatory way in any of the phases other than the collecting data phase. So I just want to draw your attention to the ... So it jumps from 12 right up to the 205. So if this table was true and to scale, that blue line that comes out from collecting data would be very, very long, you know, right down to 205. We've had to shorten it to present it here. But the message is really clear that, at least in the Australian context, there's a nice, you know, and growing body of research in which children are consulted, but very little engagement or participation across the other phases of the research. So we were wanting to do something a little bit different. So I just have a very simple little table on the next page, which summarizes our research design. Phase 1 had 2 arms to the project. The first arm, well, the first of the 2 arms was about working with young people, and we've called it the sort of supporting their voices to be heard arm of the project. What we did at the same time was an arm of the research project with service professionals. Sorry to be cheesy, but you know, we've kind of called it the preparing ears to hear arm. I know that's a little bit cheesy, but it was the idea that we needed to work with both of these groups at the same time. And I'll say a little bit more about that in a minute. Phase 2 of the research was about selecting and refining ideas that the youth generated in the sessions that we were running with them. And phase 3 of the design is an action research phase where we actually implement those ideas and over 3 waves look at the impact of those ideas in practice. So just to unpack that a little bit more, so it makes a little bit more sense. We engaged with young people aged 15 to 18 years, and there were 3 tasks as part of that engagement. We spent time with them and engaged with them around reconceptualizing the service system. So we explored what their experiences with services, a whole range of different services had been like, and how they thought that maybe services could be different, whether that's in terms of the way that they were delivered, or maybe some shouldn't exist at all, or maybe other services should exist. you know, if we started from scratch on a piece of paper and we were setting up services to support young people, what might that look like? So that was the first phase of this work with the young people. The next was a youth-led research phase. So the young people in our groups took their ideas and generated surveys or interviews, and they then went out and collected their own data to sort of test their ideas with their peers. And then in the third phase, they brought those ideas back. And that third phase was all about the development of a service initiative. So the whole idea was that we built towards a pitch day. So pitch day was a big day where we had lots of service providers from the community come together, and each of the groups of young people presented their idea, their one idea. So they just settled on one idea that they'd really like to pitch to service providers, and that's the idea that they pitched. And we'll talk about those and cover those while we're talking with you today. Just to mention briefly, this is one of those projects, unfortunately, that was quite significantly impacted by a range of factors, including, you know, the dreaded COVID. And so our original design had to shift. We originally wanted to work with young people, just one group of young people, so one group of about 15 to 20 young people potentially over a 12-month period to work through those phases. In the end, because we experienced quite significant delay in the project, we had quite a lot of difficulty with recruitment and gatekeeping. And if you like, we can come back to that in the Q&A session and talk about that a little bit more, but that was a very significant part of the experience of this project. We ended up having 5 small groups, so 5 groups of, on average, about 5 young people in each group, rather than one larger group. And so we worked in those 5 groups, and some of those groups we were able to work in a sustained way, so, you know, weekly for a couple of hours across a sustained period of time. For other groups, it was a more intense, you know, full day experience, or, you know, a couple of days, full days. We spent about 20 hours with all of the groups. So we'd originally wanted to spend quite a bit more time, so that was less time than we'd originally planned, but it was on average about 20 hours with each group. And they all developed a pitch that they presented on pitch day. And I think Kelly is going to speak more about that later. So at the same time, we wanted to make sure there was fertile ground. So we knew from the literature that often young people's views were dismissed, or, you know, young people could come up with all sorts of ideas, but if there weren't service professionals who were willing to listen and engage with them, you know, that it was very difficult for those ideas to be taken further. So we also were working with professionals in the community. We developed a whole professional development program around children's rights, around participation, around how to engage with children and young people in a practice context. And we also collected data with those service professionals. We explored organisational and cultural barriers to children and youth participation, and we talked about how to overcome some of those barriers. So we had those consecutive pieces of work happening. We finished phase 1 now, and we're in phase 2. So 5 pitches, 5 ideas were pitched, and to date, 2 of those ideas are being taken forward. So there are service organisations who put their hands up and said, we'd like to pursue that. We'd like to work with you to pursue those ideas and work with those young people. So that's the phase in now. And I think I'll comment on that briefly, but mostly we're going to talk about phase 1 in this presentation. But we're really excited that we're able to take some of these ideas forward. And of course, the next phase then will be an action research phase where we look at the impact and effectiveness of the ideas of the young people in practice. So that's our project very much in a nutshell. And I think I've probably taken a little bit too much time. So I'm going to very quickly hand over to Jonathan and to Angelica, and ask them to talk to you about some of the barriers that were described in our project.
Thanks, Rebecca. So as Rebecca mentioned before, we did, through our consultations with the service providers, as well as working and engaging with young people, we actually did identify quite a few barriers, and we'll take you through some of them now.
Thanks, John.
So Yeah, so
No, you go ahead.
yeah, sorry, Angelica. So as you've heard from Rebecca earlier, we worked with different groups of young people throughout 2020. And we also worked with the service providers at the end of 2020 to get some of the feedback on their experiences within the organizations, and for the young people, with interacting and engaging with the service systems. And we found that there were actually quite a few overarching themes or barriers that they encountered. It's really interesting because it was only after we began to really analyze and make sense of this data that we realized that was more of a common or almost sometimes shared understanding of where the problems actually lay. Angelica.
Yeah, so and that is actually something that's really interesting with all of the themes, in particular this one, which this first theme we saw throughout a few of the experiences that young people were sharing, and organizations themselves can be perceived as imperceptive and rigid. And when it comes to the young people, from what I explored, is that young people felt as though organizations, not specifically the individual staff, may not actually be receptive to change. So that's change that the young people hoped for in programs, or change in regards to what they saw as a priority to be focused on within the service that they were engaging in. And one of the examples that I can provide here is that some of the young people in the sessions described feelings of frustration towards the organizational approaches when it came to transition between services post-custody and within custody. Some of them cited that the priorities between the service providers were kind of misaligned with their own priorities that they identified as, needed to feel secure or supported with the essentials that for them to actually just grow and live well. So one of the quotes I really want to speak to is that first one that you can see on the screen there, and I'll read it out in full. And one of the young people shared, housing should be the first priority, that custody should be like dealing with, and like probably employment as well. So when you get into that housing, then they can set you up with employment. What that young person was highlighting here was that this idea around what programs or what services should be focused on within custody actually wasn't occurring. And when they expressed that as a way of change within the sessions themselves, there was a little bit of pushback from the staff that were present there about that idea. So that's just one example to provide about how young people actually feel when it comes to the rigidity of the system. But I do want to acknowledge something that was really striking throughout some of the sessions, was that a lot of the young people acknowledged that the ability to change or move out of this rigid structure doesn't solely rely on the staff, or they actually saw that it's a bigger system that they're trying to work, that staff are trying to do their best to work in and under, and that there's sometimes indirect opportunities to influence change. So you'll see that one young person said that we can also see that staff are actually struggling to work within the system itself.
So similarly, when we actually spoke with practitioners, the staff members from the organizations, they cited that same rigidity. They said that there was a lack of follow through. There was just not enough time and funding or resources to continue consulting young people, children and young people. It was essentially cheaper and easier to write and distribute. At the same time, that rigidity extended to their evaluations of engagement, or measuring how well they engage with young people. And they acknowledged that tick boxes were not an accurate measurement of engagement, but that's the only way we can actually measure it for now.
And so the second theme that we had actually focused a bit more on the policies and practices within an organization. And we actually saw that there was a lot of commonality between what the young people observed as well as the service providers, that policies and practices as they stood assume the homogeneity of young people and do not acknowledge the diversity and complex needs of young people themselves. So to give a specific example of this, two actually, we had young people who were talking about the mental health policies that exist within the school system and beyond the school system as well. And they were talking through their experiences of being ethnically and culturally diverse within Australia, and the impacts of migranthood as well, and racial and ethnic disadvantages that can at times come with that. And that the current mental health model, or the way that mental health is approached within the education system, is one general structure. So it at times lacks the ability to take into consideration the unique experiences of those young people, even though that they were going to a school that is really culturally diverse. The ability to reflect for policies and practices to reflect on the cultural, social, and economic circumstances of young people as perceived by the young people is limited. And there's one powerful example, a young person who was sharing about their experiences with the suspension policies at school. And when I looked at this example, the heart of that experience of that young person was that they didn't actually see their socioeconomic and social situation at home being the barrier between them participating in school. It was actually the extent to which the service, in this case, education, understood their circumstance and adapted their practices to ensure that that young person didn't feel further advantaged in school. So they've said here, for most schools now, you have a laptop, school uniform, school books, school essentials, as well as having the right shoes and all the rest of that crap. That's a lot of money. What families that live in housing commission like mine have that sort of money just waiting in their pockets to spend it all? I think there's this overwhelming sense to young people that the importances of some practices don't actually assume that all young people are on the same level and are able to meet the standards that these practices expect of them, but it's not always the case. And consequently, in this example, that student shared how they were actually suspended, despite actually saying that their family was struggling, and they were showing that their family was struggling, and even offering pathways as to better ways for their family to participate or have their views acknowledged and taken on board. But that was actually rejected. But again, I want to go back to what the young people said before in the previous theme about actually acknowledging that the staff, sometimes the staff are actually just doing as they're told. They're following their own practices and policies that they have to adhere to. But there was a sense of gratitude towards those who went above and beyond and were able to accommodate to their needs, and took time to actually, as one person said, to know me and to understand me.
And again, the service professionals were echoing that sort of, it's not just one size fits all. It wasn't just the approach. In terms of the programs, service professionals were also saying that the organizations were doing a one size fits all policy for gambling or addiction programs for their young clients that they were using with their adult clients, and that they didn't really cater to young people from diverse backgrounds. They also echoed, there was a lack of representation of in voices, especially from those from diverse backgrounds. There was no continuity of care from services when it came to exiting clients, and you really hear that from the young person's perspective as well. It's interesting how they seem to echo each other.
And so the third thing that we found that was, again, another commonality that came between the young people and the service providers was that relationship forming and social connectedness are low in priority. And across all of the experiences and all of the groups of young people that were part of this project, there was a common topic about relationships in regards to service engagement. But when relationships were spoken about, there were a few instances where relationship forming was an intentional process. In fact, young people perceived relationships to be formed by chance, or seen as secondary in terms of priorities and the foundational culture within the service system. And so the relationships within services and social connectedness that young people saw that was essential to their development, and also to them being able to participate more actively within a service was actually not being prioritized. And I do want to actually point out this example that's on the screen where a young person actually shared an example of the impacts that intentional relationship building would have. So I feel like younger female teachers would be better for a girls' school, because then they could actually connect with students more. So maybe the students will feel more safe because they're connected to the teachers. That's an example right there where a young person is seeing that that relationships are important to them being able to engage in the school environment. However, is that a priority at the moment within the overall system? The young people perceive not as much.
And while some of those service professionals acknowledged that there was value in forming really strong relationships and connections with the young people, and they also felt there was a bit of resistance from the organizations. There were contradictory messaging from the higher ups, and they did cite that they needed organizational buy-in or greater buy-in and support from their higher ups to do that. They said the organizations weren't structured for participation or fostering those healthy connections, and they really needed the backing of executive staff members to do that.
And so the last theme that we have, and I'll keep it really brief as well, is on the topic of ReSPECT, which seems coincidental considering the name of this project. But young people and service providers, there was an overwhelming sense of a different conceptual understanding and operationalization of ReSPECT or respectful engagement and what that actually means. So young people perceived ReSPECT as something that they saw that they had to earn, and even to the service providers that they had to earn. But when you look at the flip side, for service providers, young people felt that they were expected to afford automatic respect to service providers through this idea that they're providing a service to you, you're engaging with it. So it's like an automatic, you must respect this kind of environment. And they felt that it also extends into the engagement as well. So young people felt that staff didn't understand how to engage with them because of this dynamic of what respect actually means between service providers and young people. And so there's a few examples of this that you can see in some of the quotes. I won't read them out, but hopefully you can read them because they're really poignant to this point. But there's a really powerful example of a young person who went to a service, who knew what they wanted and just wanted someone to provide them help. But they described their experience as being talked to like they were a child. And even when they actually asked for the respect between themselves and the service provider, that the service provider acknowledged it. And it's still, this engagement still was the exact same that young person experienced. And so it's these types of barriers for young people that can actually draw back the intention of participation within a service for them, and actually challenges the way that we think about what is a respectful dynamic between the service system and young people presently.
And as you can see in our point, some of the staff did acknowledge that there was a level of jadedness, especially with practitioners in the juvenile justice system, and that they did have a punitive approach to engagement, where some of them have been working for quite a period of time in that service system, and they themselves were burnt out. However, there were also some of their colleagues that felt that they understood that engagement would be different, look different to the young person, and that sometimes due to long periods of their service in the sector where they're used to practicing a certain way, it sometimes creates a negative environment for young people to express their voice. So we can really see that there's actually a lot of vulnerability in the service professionals that actually try to engage with our team. And it's a shame that the team that you see with us today is just a part of the bigger team that's actually done a lot of the work with with the service professionals. And I think it just speaks of the opportunity for us to work more with service professionals and really understanding some of their barriers and trying to find grounds to tackle those barriers together.
Oh, sorry, Jonathan, I thought you would hand over. So we'll hand over to Samia and to present the next section. I'm just conscious of time running out. So we have Sam, a recording of Sam, and hopefully that'll work for us. So it looks like that sound isn't working.
Okay. Can everyone hear? Is there no audio?
I just can't hear Sam.
Yeah, John, I think that maybe sometimes when you can't hear the audio from videos, you need to set something in Zoom that makes it.
I might do that. Yeah.
Play the sound.
Oh, so is it just
Sorry
me
about
that
that,
can't
everyone.
hear? Okay.
No,
No,
I
it's
can't
not
hear it
just you.
either.
Sorry, everyone. Just give me a moment. Try that again.
Hello everyone, my name is Samia McHale. Sorry I can't be with you in person today, but I'm very happy to be sharing with you the professional development component of the ReSPECT project. In this part of our research, we worked with service professionals from diverse organisations and the young people we engaged in service innovation design and brought them together. We aim to support service professionals to build their capacity to engage with children and young people in everyday practice while working in their diverse siloed services. We chose to do that by addressing some of the barriers to young people's participation that staff identified as challenging and the barriers that were raised by children and young people themselves. We used a specific method and methodology to provide this unique development opportunity. It was cross-sector, so including staff from child protection, education, health, juvenile justice, and community services, both practitioners and senior policymakers. It was a multimodal design, so with a range of ways to engage with young people's participation. We had a theoretical approach to young people's participation, including lectures. We had international experts who delivered content on models of practice. We had video content by young people directly on their ideas of service innovation. We had a range of interactive focus groups and small group discussions on challenging barriers to participation and specific work contexts. And of course, participants had access to a range of resources, practice guides and checklists. We looked at the level of confidence and knowledge and skills of participants using pre and post surveys. And of course, we have ongoing contact with those participants. This unique approach to professional development offered service professionals the time to engage with two things, both the conceptual and the practical aspects of children's participation. It offered time, guidance, connection to young people and support to apply their knowledge to their own work context. And it's an ongoing process where they can continue to reach out to the ReSPECT team. Our methodology demonstrated how practice can be co-designed, where decision makers are informed by the lived experience of young people. Our method offered participants the chance to leave the training with at least one clear strategy for improving children and young people's participation in their workplace. In our post-survey, staff felt more confident because of the resources and the support that they received to think through those barriers to participation, as you can see from the comment on this slide. And they also commented on how they valued both the theoretical and the practical tools that they were provided. At the end of our development opportunity, participants were asked to send a message back to young people. And these messages really express the supportive and responsive attitudes towards young people's engagement and towards the young people who shared their ideas about service innovation.
And I've come on this course today to learn how we can hear your voice better. Your voice matters. It has power, it has strength, it has wisdom, it has knowledge that goes beyond what an adult voice does. So all I want to say is keep at it, keep raising your voice to be heard. Your opinions and views are precious amongst all the adult noise. We are changing as adults, and we are ready to make an impact to help your voice be heard more clearer. So that's what we're here to do, and we hope that we can bring that passion to other adults to make sure they can be done.
I've been working in child protection for the last 13, 14 years, and I just wanted to say from a service perspective in the different places I've worked that we haven't done it well. We haven't listened to you well. We haven't always heard what you want to say, and we haven't always let you participate in your own life. And coming to the last 2 days of training and hearing your stories makes me passionate and empowered to make sure that I use my voice to capture your voice. It's really important to me. I'm here to act, I'm here to listen, and I'm here to learn. Thanks.
And so you can see, in addition to these attitudes, service professionals were also clearly able to offer up how they were going to listen and act on the young people's ideas. And here are some just two strategies from our post-survey responses. And in this first quote, CCI refers to consumer and community involvement, which is a program of work that aims to embed consumers in the health and medical research policy and practice. There are other strategies as well that participants put forward, like staff induction processes being modified to include children and young people's participation, or questions being included in quality assurance audits against the 10 child safe standards that we have here in New South Wales, Australia, and building a group of professionals within their organisation to continue to work on what they had gained from this training. If you
Hi everyone, my name's Kelly Baird. I'm not sure what happened to Sam's last little part of her video, but we'll just move on. I am just going to very briefly really touch on what we did sort of with the young people in terms of the service initiatives, because we have a video to show you that sort of brings together all of the service initiatives so that you can see what were some of the ideas that the young people actually came up with and pitched to the adult service decision makers. So on this slide, basically, there's a quote, and it's actually from Harry. And it's quite fitting as well, because at the moment we're writing a paper together about a group of us in the ReSPEC project about our experience of gatekeeping within the ReSPECT project. So, but this is from an early publication of Harry's, but he highlights the role of adults as gatekeepers and the idea of that adults can control the access to young people. And in effect, it denies young people their right to participate. And as others have already spoken about in the webinar, this is a barrier to participation. And it means that when we're denying these young people the right to be heard. Next slide, John. So blue sky thinking, or the re-envisioning of the service system, was often a difficult task for many of the young people. And it wasn't because they didn't have the sophistication to think of the creative and innovative solutions or ideas for service redesign. And you'll see that later on, that they're incredibly capable of doing this. But it was because they were really skeptical about whether or not those service providers and the policy and decision makers would genuinely be interested in their ideas, and whether there would be a willingness for these people to actually partner with the young people and trial their initiatives within their own services. So it's why it's quite exciting that actually these young people were showing that, you know what, we have some ideas and people are willing to take them up. Next slide. Okay, so this is a quote from one of the young change makers. and I feel that this is it really gets at the core of why it's important to include young people in service design. It's because they have the first-hand experience and they bring with them that new and creative thinking that us who have been around for a long time or don't have those experiences don't have, can't really bring that type of thinking into the situation. It's also why the efforts can't be tokenistic, because tokenism undermines the genuine participation of the young people. And reducing the risk of tokenism requires that the service providers and policymakers are willing to relinquish some of the power that they have in the decision-making process. But by doing so, it can support the meaningful and impactful participation of young people and children and young people in service design and reform. Next slide. So as Rebecca had mentioned earlier, there were 5 groups in the with our change makers. So our change makers, we had a group who were in a youth justice centre. We had a group who was in an alternative educational setting, so not a mainstream high school. We had an online group, and there was 2 community groups. One who was a group that was made up of just young women who were from migrant backgrounds, and another group who was a group of mixed boys, well, male and female. They were teenagers, and they were living in in a suburb that had high levels of disadvantage and a lot of Department of Housing backgrounds, that sort of thing. So they had a lot of complex issues going on for them. This slide, basically, I'm just trying to bring to the attention what was some of the main what our young people really were interested in. So I don't think that there was a single group that didn't feel that mental health was the priority. You know, it came up time and time again that mental health was what they really needed to focus on. I'm sorry, my computer has just told me that it's about to restart. Let me just try to snooze that. Sorry, this is, fingers crossed that that doesn't happen. Yeah, so the mental health was a big thing for them and a top priority. And that also included being able to improve access and understanding and awareness of not only the services available for mental health, but other services within their communities, but also in helping support other people in their lives to be aware of issues that are going on for them. So that included parents and others. Okay, so this is, sorry, John, sorry, I've just back to that other slide. Some of the groups started with really, really big ideas, and they were really, that was like our blue sky thinking type of ideas. And so it was working with the young people to really narrow down what is it that these big ideas have that you really want to address, and what is something that is manageable, that can be implemented, and that when we pitch them to the decision makers, they're willing to actually take it on, because they can't have the excuse of that's too big, it's never going to work in this context or the setting, or it's too expensive. So we really helped, they really worked out, what is it that we really want to address? How can we make this happen in a way that isn't going to not have it meet the needs that we need it to make and the difference that we think it's going to make, but it's still going to be different and creative and innovative. So on the slide that was up just before, it's just got a little spiel about each of the pictures, but I'm just going to ignore that slide because you'll see that in the video. And the last slide before the video is I just had some tips that in working in, I called it working in the ReSPECT way, but there's 4 tips that are probably the most important I could think of. So we all know rapport is so important in research, and it's even more important in research with young people, and even more important in research where these are hard to reach young people who aren't often engaged in research. And we know that food helps when there's teenagers involved. We need skillful adult facilitators who are genuine in their interactions with the young people. So they need to be able to just have those conversations and not try to be, and I'm going to skip to tip 4, not try to be cool. I'm 38, I'm going to act like a 38-year-old. I don't have to act like the 15-year-old to get that, to have that relationship with them, because I also see through that. They don't want me to act like a 15-year-old. They want, you know, they know that I have skills, they have skills, and how do we work together? And we did try some, because of coronavirus, we did try some of the groups doing some online stuff. We have one online group and they were excellent. They were older, and there's a few other issues I think that made that group work, as opposed to Zoom being used not so effectively with some of the other groups. So as that tip there, it's always much better to be in the same space and always face-to-face when doing this type of work. So they're the 4 tips, but really what I wanted to show you is our video. So I'm hoping that it is going to work, and I'm going to go on mute. So I hope you enjoy it.
Hello, my name is Brendan, and your time and attention will be very much appreciated over the next several minutes, because this has been a long time coming for me.
A smaller idea youth hub is another youth hub that is sort of like it's travelling. It comes once or twice a term, and it only lasts for about a day. It's helping. It's mainly for the seniors of mainstream high school, so for year 11 and 12, but specifically for year 12, help them transition from high school to real life. Since we don't have one for them, but we do have one for year 6 going to year 7. So this would be a good support thing for year 12 to finish school. And it will consist of a variety of services, which include like Centrelink, employment services, counselling services, and youth workers, which I personally think should already be in high schools anyway, and also drug and alcohol services.
The main issues that we addressed, we have concluded that an app is the most useful platform for the young people to access and find information on various services in a local community. As seen on the screen, our app's main menu would consist of all the available services sectors as well as the human rights.
Each service sector would be divided into subcategories, exploring the main issues within these categories. Information in each subcategory will include frequently asked questions, information sheets, flyers, helplines, websites, and Ask a Professional option.
Running a life skills program during unit program time at least once a week to begin with. The program should be open for everyone to attend and should run for between 30 to 45 minutes. For example, we could have a class to learn skills to write a resume to help us with employment when we leave, or do role plays about how to do an interview. For people new to ReSPEC, a life skills program could run alongside the induction and includes things like learn to make a bed, room care and basic hygiene. We know that cooking requires a risk assessment, but we could look at options that are low risk, like fruit and vegetable platters, dips and salads and other raw and no cook options. Stage 3 and 4 could do the cooking, and stage 1 and 2 could do the meal presentations. Learning to cook for ourselves would really help. Cooking could be incorporated with budgeting, where we learn about meal planning and preparation, and shopping, and how to make multiple meals from the same ingredients. While during inductions, we are given all the information about the supports that are there.
Your mind, our space. Don't be scared, we care.
Don't be frightened, we enlighten.
What we want our space to look like, we want it to be outside but near shops.
We would like it not to be housed within any existing service providers.
We would like it to offer food and drinks. We would like it to be colourful and inviting for all.
We would like there to be daycare facilities.
We would also like there to be an indoor space such as a house. We would give gift bags to you if you are leaving or if you're new.
We would like staff to give the youth 2 weeks notice before taking time off work or leaving.
We would like to see a developed website with staff profiles for youth to look through. We will be available during the day and night, for example, doing shifts.
If a small group of us with only two young people in it can come together and come up with this training tool, how amazing would it be if we recruited a force of young people specifically to create training tools for counsellors working with youth. Something very similar to what the ReSPECT team have already done here. We realized that our first idea of just creating a training tool ourselves would be more of a short-term impact, whereas employing focus groups of youths to create mandatory training for youth counsellors would have a stronger and longer-term impact. Creating counselling that is more patient-considerate and patient-focused should be the future of counselling. And what better way to do that than having counsellors undergo training created by the patients themselves? So strangely enough, that's our initiative, to create a project similar to this one. But the differences being that the young people would be employed for the length of the project, and the end goal would be to create mandatory training for youth counsellors by young people. More change needs to occur, and we need your help. Thanks for listening.
Thank you so much, everybody. I haven't kept my promise to allow time at the end for questions, and I'm so sorry. We're all happy to stay on for anybody who is able to stay on to answer questions, but also we invite contact via email from anybody who would be interested in engaging with us, and we would love to talk to you more. So I'm sorry that we've really pushed against the time limits today.
Well, thank you so much, Rebecca, Kelly, Angelica, Jonathan, and Sam in her absence. Yeah, I mean, yes, we have gone over time, but it was so interesting. I've been engaged with this project for a long time, and I'm still learning new things. So if it's all right with you, let's keep the thing going for another 5 minutes, just in case there are some questions or people want to know more. I've tried to promote all the participants to panelists, so you should all be able to put your mic on, unmute yourself, switch on your camera and ask a question. So yeah, would anybody like to go ahead? Would anybody like to ask a question of any of the ReSPECT team?
Sorry, Harry,
yep.
I really wanted to congratulate. It's not a simple project. There are so many different layers of this project. I think you really probably need at least 2 hours, maybe a whole day to explain what was going on. You know, again, that time was very short, and I understand. You really want to tell us what exactly going on, because it's like a multiple layers and so many things happening, and then coming out that different ideas and concept. And I really like, Rebecca, the way you did the scoping review, you know, using the Harris metrics tool. That was really beautiful. I mean, even for the student to understand how we engage with the children at the service level. I think that was really good. Then going to the different angle, and then that youth-led initiative, you know, what they want. I think that concept, I think Kelly, you really come up with that concept. And I thought that was really clever, because we always try to design a service for them rather than bringing children or young people voice what exactly they want, and that co-design approach really come up very strongly. Maybe I'll ask that question to Kelly. How did you find that? I know it's quite challenging to bring different age group, different ethnicity, different culture. How did that went?
So that was what our original design had been, to have a larger group of young people from lots of different experiences and backgrounds and all of that sort of stuff, so that they could, because our idea was always to be to not make it sort of set in silos. So we didn't want our young people to also be set in their service silos, but it was quite a difficult project to recruit to for lots of different reasons. But in the end, to make the project work, we did have to go back a little bit more to more siloed, I guess, type of groups of young people. But even within the groups, they all had different experiences and backgrounds and all of that sort of thing. And I think that what worked with the young people is that the young people knew each other in the groups. Like, mostly they knew each other, or they knew at least someone else in the group before coming into a group. And then obviously, being an adult facilitator with some young people, you then need to have some skills in able to manage those dynamics and to be aware of what's going on for the group. And you know, people don't need to talk if they don't want to talk, and setting some pretty agreeing on ground rules and things before you start those processes. But the young people were really quite amazing by themselves, really. Like they didn't need a lot of hand holding or anything like that. Nothing. Like they were just, they have their ideas and they just want to share them.
I think there's a lot of learning for us from COVISION, because we have something similar in the phase 3 where we are going to do a code design. But again, our challenge at the moment with the COVID-19 and online platform. So we are learning a lot. Harry will be able to tell us, but it's a lot of learning happening. But that is one of the challenges we are facing. But I really want to say thank you so much from the group. Very late in Australia, but still you are with us, and thank you so much.
Okay. Harry will know that one of our groups, the smallest group, was they were an online group, and that group worked incredibly well as an online group, but it was very difficult in other contexts to do it over Zoom. Like maybe if the group started that way, it would have worked. Yeah, it's hard to do that type of work with them online.
Okay, thanks. Well, thanks also, Suja, for that lovely feedback. We are over time, but we're still here. If anybody would like to ask a question before we finish.
Hi, Harry. I might
Yes,
jump
Danielle.
in. How are you? Good to see you, and thank you for this excellent seminar. And apologies, I'm on my phone because I was going between places, but it was great that I was still able to have the earphones in and listen to everything, because as Katie said in the chat, I think some of it was mind-blowing. It was really excellent. So thank you all, and congratulations to you all. I mean, really have a question. I won't delay people here, but maybe we can follow up at another time. But, you know, I was just really interested, and be no surprise to you, Harry, about that element of the model where, you know, the young people conceptualize their ideas for changes in service design, and then they go out and engage in youth-led research and gather the wider perspective and views of their peers. And you know, and that was fascinating to me. And you know, if we had more time, I'd love to learn more about that. But maybe I can pick up with your colleagues at a later point on that. So thank you, everyone.
Okay. If anybody has another question, do please come in. But I'd like to, before we finish, just do a little trailer for the next COVISION webinar, which is Wednesday, the 9th of March, just 4 weeks away. The title is "The Impact of the COVID-19 Pandemic on Children with Special Educational Needs and Disabilities." The Ask, Listen, Act study, and we will have with us Emma Ashworth and Amel Algrani. Now let's see which university they're from. Emma Ashworth and Joanna Kirby are from Liverpool John Moores. Lucy Bray is from Edge Hill University, and Professor Amel Algrani is from Liverpool University. So we have 3 top English universities, 4 excellent speakers joining us for the next webinar. So I just want to put that in. All that will be on our website probably tomorrow, and on Twitter as well. So I just wanted to say that. Now, one last question, and then I'll go back to Suja to say goodbye. So here's one. Shelley Turner on the chat. I'm very interested in the tensions between the vulnerability and responsibilization of young people, especially in youth justice. Well done in involving youth justice clients in this study. There's Shelley. Hi, sorry, I was reading it out because I didn't see you there. Yeah, anybody from ReSPECT just like to have a final quick comment on that point, because it is indeed, yeah, I totally agree.
Yeah. Oh, sorry, go ahead.
No, you go.
Oh, look, I'll comment very briefly, and then you can make you comment, Kel, as well. But look, I think yes, that was a really interesting issue, and I think we spent a lot of time at the beginning of our workshops with those young people, convincing them that we were actually going to listen. They came to those workshops with lots of experience of feeling very unheard, or as though people ask for their opinions but then don't actually care or act on those opinions. So that, you know, having had experience with being young people who'd experienced quite considerable disadvantage or adversity and engagement with lots of different services, they were acutely aware of their own vulnerability, or that they would be labelled or seen as vulnerable and seen as having a view that couldn't be taken very seriously. So there was a lot of work that we did around that, but they did take on a mantle of responsibility in that they wanted, as time went on, they wanted to be part of seeing positive change and being part of that, and feeling that they had a role to play in that. So I think that's a really interesting issue that we grappled with quite a lot.
I want to abuse my hosting role to comment on that, because the responsibilization issue is something I have written about. And for me, it's very important to understand that young people, in whatever context or setting, however vulnerable they are seen, can decide to take responsibility for aspects of making change, but they must never be held responsible for the failings and wrongdoings of adults. And when we just talk about responsibility, sometimes we lose track of that very important difference, especially in terms of, say, violence, child abuse. Young people are never responsible for what happens to them. But yes, they can take responsibility. They can become human rights defenders. They can organize. They can protest. So as long as we understand that difference, we won't get mired in responsibilization. So apologize for butting in there, but I think that's worth understanding.
Oh, thanks, Harry. I really want to second what you're saying there, and that is a concern I see in the developing trend towards co-production and co-design, and the lifting of lived experience in settings like youth justice and child protection in particular. So I think that's great. Thank you for those comments.
And I'll just add, as a practical thing of working with the young people who are in the youth justice centre, they were unfortunately not allowed to be left alone in a room with us, and so we always were, you know, dealing with the input of their workers, and it was the most frustrating situation to have the adults in the room sort of almost disagreeing with what the young people were saying, and it was disappointing that they couldn't see themselves why this project was so important, and particularly within in a context where the young people are so powerless in making any change to their day-to-day lives that they're leading, and they had that sort of experience. And the other thing is that the young girls in the youth justice, so there was a group of all women, and they were probably the only group who actually really understood and thought through, okay, what are we going to be allowed to do? What can we get away with? What is going to be able to get implemented? So they already, when they wanted this life skills program, and they wanted to be able to learn how to cook, because that's an important life skill for these people when they leave the Youth Justice Centre. But they went, okay, we can't use fire, or like we can't use heat, we can't use sharp knives. Okay, we'll do no heat cooking. All right, but only some of us have particular rights and aren't allowed to leave a certain part of the centre at certain times. So we'll need to just split it up between the ones who have the privileges and the ones who don't have the privileges. They did all of that thinking themselves. It was amazing. And yeah, so that was that as an observation, I guess, more than anything. That was, yeah, my comment.
Thank you. Thanks, everyone.
So Suj, I think over to you now to do the wind up. Yeah.
I really wanted to thank you, everybody. It was wonderful, and especially the time and social hours, I would call it. You know, from Australia, and you are joining us very late in the evening, very late night now. Thank you so much for spending time with us. And on the behalf of COVISION team, on the behalf of UCD, which is University College of Dublin, Ireland, and the funders, we would really wanted to thank you for your contribution to this project and leading this webinar for us. Thank you so much, guys. Hope to see you in the next webinar, and have a good day and a good night.
Bye, everybody.
Bye-bye.
Thank you so much.
Everyone.
Thank you.
Thank you.